Your doctor has prescribed the Acapella Choice for your use. This device will help you raise secretions from your lungs to speed your recovery. This short program will introduce you to Acapella Choice, its benefits, use, and care. Your lungs produce mucus as a normal part of a process that protects them from infection and disease. In healthy lungs, the mucus is cleared by the natural flow of this mucus into the larger airways, followed by coughing. A variety of pulmonary conditions can upset the beneficial mucus production and clearing mechanisms, leading to difficulty in breathing, infection, and over time, the destruction of lung tissue. Acapella Choice was designed to assist your lungs in moving the mucus into the larger airways so that you can cough it out of your system and help decrease the possibility of infection. Let's take a look at how Acapella Choice works. When you exhale through Acapella Choice, a vibratory positive expiratory pressure is produced, which has two valuable effects. First, it shakes the mucus loose from the walls of the airways, and second, it creates a force that allows air to get behind the mucus, moving it towards the large airways where it can be coughed out, clearing your lungs. Proper use of Acapella Choice will assist you in removing secretions from your lungs. Carefully follow the care plan established by your healthcare provider. Take a few minutes to learn how to use Acapella Choice by viewing this video and referring to the instruction sheet that is provided. Acapella Choice speeds the clearance of secretions and is easier to tolerate than manual clapping on your back to facilitate opening the airways. Acapella Choice is easy to use. Place the mouthpiece between your lips, forming a seal, and exhale into it as directed. You may inhale through the mouthpiece or remove it as you prefer. Or you may be instructed to use a mask, which will cover your mouth and nose. You may inhale and exhale with the mask in position. There is a numerical adjustment dial which rotates. Turning the dial allows you to adjust the vibrations and resistance to fine-tune Acapella Choice to the particular characteristics of your lungs. Your healthcare provider will determine the correct setting of the dial. Remember that the dial should be kept at the setting recommended by your healthcare provider. Here are the steps you'll use in performing therapy. Begin by washing your hands. Ensure that the dial is set according to your healthcare provider's recommendation. Sit comfortably and place the mouthpiece in your mouth. Be sure to maintain a tight seal on the mouthpiece during exhalation. Your healthcare provider may recommend the use of a nose clip if necessary. If you're using a mask, apply the mask tightly but comfortably over your nose and mouth. Take a deep breath, larger than normal but not filling your lungs to capacity. Hold this breath for 2 to 3 seconds. Then exhale with normal force through the device. Exhalation should last approximately 3 seconds. Perform 10 to 20 breaths, or as many as are recommended by your healthcare provider. Then remove the mouthpiece or mask and perform huff coughs to raise the secretions. A huff cough is performed by forcefully exhaling after taking a large breath and holding it. Here's how. Begin by taking a slow, deep breath. Hold that breath for 3 seconds. Then exhale in a series of short, quick, forced exhalations, making sure that the airway in your throat is open. This can be done by softly saying huff as you do these exhalations. Repeat the huff cough 2 more times for a total of 3 huff coughs. Repeat this sequence of 10 to 20 breaths, followed by 2 to 3 huff coughs. This represents an Acapella Choice therapy session and takes 10 to 20 minutes to perform. You may also use a nebulizer with Acapella Choice. To do this, place the nebulizer on the back end of the Acapella Choice. It has a 22 millimeter fitting that will accommodate most nebulizers. There are many good reasons why your care provider selected Acapella Choice as an aid to your recovery. It's very easy to learn. It can be performed while sitting up anytime, anywhere. It works the same held in any position. It can be adjusted to meet your individual needs. It can be performed by yourself. You don't need a second person to help. It doesn't require the use of electricity or gas. It has a shorter treatment time than some other mucus-raising therapies. And It's easy to clean. It's important that you keep your Acapella Choice in clean, correct working condition. You should clean and inspect it on a regular basis. Cleaning your Acapella Choice is easy. To do this, you need to disassemble the device into 4 parts. First, remove the mouthpiece. Detach the cover by placing your forefinger and thumb on the ribs located near the mouthpiece. Gently press on the ribbed surface and lift the cover up. The cover should only be lifted to a 90-degree angle. Gently remove the cover from the base unit. Lastly, detach the rocker assembly by placing your forefinger and thumb on either side of the grooved surface and simply lift it up. Do not separate the pieces of the rocker assembly, which must stay intact as one unit. You now have 4 parts to clean: the mouthpiece, the cover, the rocker assembly, and the base unit. If you're using a mask instead of the mouthpiece, follow the cleaning instructions that come with the mask. Now soak the 4 parts in warm, soapy water and then rinse thoroughly. Finally, allow the 4 parts to air dry. If you prefer, Acapella Choice is dishwasher safe. Your healthcare provider may opt to autoclave or boil Acapella Choice. It will withstand repeated steam autoclaving at temperatures up to 136 degrees Celsius, 277 degrees Fahrenheit. And it will also withstand boiling at temperatures up to 100 degrees Celsius, 212 degrees Fahrenheit. Acapella Choice will also withstand cleaning with glutaraldehyde. Bleach is not recommended for use on Acapella Choice because it may corrode the interior nickel-plated mechanism. And don't microwave the unit because it contains metal parts. To reassemble Acapella Choice, place the rocker assembly back into the base unit. Make sure it's firmly seated by gently pressing the rocker assembly down. Next, attach the cover by placing it back into the hinges of the base unit. Make sure that you hear a click to ensure that it's hinged securely. The cover can then be closed to its original position. To attach the mouthpiece, you may need to press the top and bottom of the unit together as you slip it on. If at any time you feel that your Acapella Choice is damaged or not working properly, do not use it. Contact your healthcare provider for advice. Thank you for spending this time with us. We know that you'll benefit from using Acapella Choice. DHD is committed to working in partnership with individuals who have respiratory conditions in an effort to improve respiratory health. If you have any questions about this product or vibratory positive pressure therapy, please call us at our toll-free number, 1-800-847-8000, or visit us on our website at www.dhd.com.